Hi there, this is Eric Ridley, Senior Editor for AntMania.com, reporting from SIIM 2019 here in Denver. I'm joined today by SIIM Chair Dr. Jim Whitfill. Thanks for joining us today.
Thanks, Eric. It's great to be here.
Great. So I'm interested in what's new for the meeting this year.
Well, I think maybe one of the biggest things that we're really excited about is something we just announced a couple of days ago, the pneumothorax challenge that we're doing in concert with the American College of Radiology. You might be wondering, what's a pneumothorax challenge? So you probably have heard something about all this artificial intelligence stuff that's going around, really big movement, particularly within imaging informatics. And so one of the things that we're starting to see is where people will bring together a collection of cases or a data set and then ask different engineers or different folks who have models to be able to try to identify the pathology or the finding in those data sets. And the person or the team that can do that the most accurately actually wins prize money. And so it helps really accelerate the field by being able to take a standard collection of data or image sets and then find out who's able to find, in this case, find a pneumothorax, which if you're not clinical, what that just means is that it's a leak in the lungs that you get air trapped in them. It can actually be a deadly condition, so it's something you want to find very rapidly. You could imagine that if you had an algorithm on an x-ray machine that as soon as you took the picture, if you knew that pathology, that pneumothorax was there and you could alert somebody right then, actually those minutes, it's one of those rare things that where minutes can really save a life. So there's a great clinical reason for us to be able to find these things. It's a really interesting challenge. We've got a great partnership with the Society of Thoracic Radiology. So I think it's probably one of the biggest things that's new to come out this year.
You have a lot of signups right away, I understand.
It's incredible. You probably saw me tweet out. Yeah. We've had 360 teams within 3 days. So if you're used to these challenges, and these challenges don't just happen in the medical world, we're seeing them in all kinds of other spaces. And the fact that we had 360 teams in 3 days, and a lot of these folks are not people that do healthcare. So what's kind of exciting about that, these are people that do artificial intelligence in other areas that want to really kind of break the code and do some healthcare work.
Sure. Any other highlights in terms of what's new this year for the meeting?
So I think we continue to really have a lot of hands-on labs. One of the things that's special about SIIM is that we've got great didactic sessions, and I love going to those. But sometimes you want to just roll your hands up and really understand how does this technology work. So we've really set out a track around machine learning and artificial intelligence. So you bring your laptop, you download the code, you put on Python and all these other things, and what you start doing is working with the different data sets, connecting to them, and creating your own algorithms. And that's something, there are not a lot of other meetings where you can kind of walk in and do that. So we've really expanded those pieces. That's very exciting. We've also continued to really grow the opportunities for our residents, our fellows, and students. Not only is membership free for those groups of people, but they've got dedicated lounge set up. We've got a separate social media campaign, and a lot of work to really make them feel a part of the process.
You getting good feedback so far from those initiatives?
It's been incredible. I think I've been around in SIIM for a long time. 2010 was a tough year for everybody in the industry. So I happened to be treasurer then. Those were tough years. I think anybody that was running a product line had a hard time. What we've been excited about is the last 4 or 5 years, membership growth has been going up at double digits. Attendance at the meeting has been going up. So people feel like, hey, imaging informatics, it's back, and really love to feel the energy around.
It's a real vibrant atmosphere here. You can really feel it.
Yeah, it's pretty nice. We had standing room only for the opening session, which I always love to see. And that wasn't standing room only because people were afraid to sit up front. Almost all the seats were taken. So yeah. Pretty big deal.
That's right. All right. In terms of what any sort of trends that you're seeing in imaging informatics here at the meeting, and how it's reflected in the program and maybe in the exhibit hall as well.
Yeah. So I think there's a hype cycle around artificial intelligence. We started this conversation talking about artificial intelligence, and a couple years ago there were some really high-profile Silicon Valley-esque folks that were making proclamations that we weren't going to need any more radiologists, that it was all going to be done by deep learning algorithms within 5 years. I think everybody has walked that back. We're now in a new phase, which I think there's some excitement about realizing we're not replacing radiologists, but boy, there are a bunch of really broken workflows within image interpretation and image workflow that artificial intelligence is starting to come online and really help. So I talked about the pneumothorax example. if you think about the smart work lists that are out there, being able to reprioritize studies based on some guesses about what pathology might be there. So I think we're starting to see maybe a little bit more realistic approach to what artificial intelligence can bring. I mean, the other trend that we tend to see is the space around enterprise imaging continues. So enterprise imaging for us just means that not just collecting images around radiology and cardiology, but think about all these other specialties that produce images: dermatology, point of care, ultrasound, wound care, ophthalmology, all the endoscopies where they put in scopes where we don't want to talk about. And so we collect those images up and be able to display them in the HR.
Are you seeing a lot of pickup in that area? Are institutions really starting to embark on these initiatives?
I think we probably see is sort of linear growth in that area. So it's not exponential like we might have seen with PACS or even AI have been sort of like exponential pieces.
Sure.
Enterprise imaging continues to be growing, and we're seeing more and more institutions. They still tend to be the bigger academic centers that are moving towards enterprise imaging. I work at a large community hospital system, and I think we've been in the community hospital system a little slower to adopt that.
Are the barriers to that more technological, or is it financial, or just competing priorities?
That's a good question. I think there's a couple things. One of the things we've learned from work of Lou Lanham and Chris Roth, who are really pioneers in this area, is governance is where you have to start off from. And as someone who's an internal medicine physician, not a radiologist, you have to be sensitive to, if you try to do enterprise imaging governance by having a radiologist come in and say, let me tell you how to do your work, that doesn't really go very far. So building a sense where everybody has an equal stake at the table is the beginning part of really a successful enterprise imaging program. Then once you get through that, and by the way, that takes a lot of work, building that sort of coalition of governance then sets the platform for overcoming some of the workflow challenges. So for example, this gets super technical, but dealing with encounters like versus order-based workflow. In radiology, we're very order-based, but in a dermatology clinic, if you had to put in an order for every single skin lesion that you were going to take a picture of, the dermatologist would cut your head off, right? That'd be crazy. The nurse in the emergency department who's got to document potential child abuse, if she's taking 15 pictures of a patient, she doesn't want 15 orders. So this idea, but we're solving some of those problems. So the technical things can be solved largely.
Okay. All right, the last question I have is relates to patient engagement. This morning we had a great presentation from
Allison
Massari, yes. And I followed up on last year's talk from e-patient Dave. And I'm interested in hearing about what can the imaging informatics community and radiologists as well, who are part of the imaging informatics community, what can they do to kind of increasing engagement with patients?
So I think it begins with maybe tapping into a lot of the reasons why most of us went into healthcare. Even if it's healthcare IT, healthcare research, we like the idea that what we're working on really benefits somebody on the other side of the on the other side of the camera, on the other side of the table. Thinking about patients, so for example, at some institutions they're starting to put in, and we're going to be doing this, putting a patient's photo in the electronic healthcare record. Because it really, even if you think about a radiologist, so a radiologist reads his study, she sees maybe a mammogram or an ultrasound or an MRI of the brain, and yes, there's a person behind there, but I think we all respond a little bit differently when we see somebody else's face, and it reminds us that there's a person there. Sure. That's a tiny little step. I think there's a growing space around open notes, so allowing patients to get immediate access to their electronic healthcare records, including the radiology reports. Mm-hmm. There's a lot of debate that goes on around that. So how do we as physicians maybe begin to tailor our communication in our notes so that we're still documenting all the things that we need to, but we know that there's going to be a lay audience that's looking at that. That's not easy, but there's a lot of work starting to go into that area.
Okay, great. That's some great practical tips there. All right. Well, thanks very much for joining us today, Jim.
It's great. Eric, thank you so much. Really a pleasure.
Great.
Hope you enjoy the show.
I know I will. Thank you. All right. This is Eric Ridley signing off for AmpMini.com.